Let's talk about the primary cause of sciatica and what symptoms can help the symptom of sciatica. What's the one treatment that studies show that must be done in order to get the long-term relief of that sciatica nerve pain? Hi, my name is Dr. Rob Bates. I'm a chiropractor and certified athletic trainer. Before you perform any of these activities that I talk about, make sure you check with your healthcare provider to make sure this is correct for you. Before I show you the best treatments to get long-term relief of that sciatic nerve pain, let's talk about sciatica, because sciatica is inflammation of that sciatic nerve. The sciatic nerve is made up of a group of nerve roots that come out from the low back, the lumbar spine, and the sacrum that joins to make that sciatic nerve, which is the largest nerve in your body, and at one point is going to be about as thick as your thumb. So it travels from your rear and your butt all the way down the back of your leg, and it carries messages from that central nerve system, the brain, the spinal cord, goes down through those nerve roots and goes out to the sciatic nerve, and it controls all functions of all the structures and the muscles in that area. And then messages got to go back up. That's normal function. So the most common cause of sciatica is going to be a disc bulge or disc herniation. That's going to happen back up at the nerve root to where it's going to irritate one or more of those nerve roots. It's going to cause symptoms of pain going down into the butt, like a dull ache, or it could be a sharp shooting pain going down all the leg, or it could be pain, tingling, numbness, weakness, cramping, burning. There's a lot of these different nerve type pains that can happen. So some of the most popular treatments for sciatica could be anti-inflammatories, could be over-the-counter or prescription. It could be steroid shots, it could be ice, or it could be physical therapy in the form of like ultrasound, electric stimulation, massage, or exercises or stretchings. All those can actually change the symptom and get some relief of the sciatic symptom. But none of those are actually going to address the cause, the fundamental cause of what's causing that sciatic symptom. Because the cause is coming from that irritation back at the nerve root from the disc bulge or disc herniation. Studies that show on lumbosacral radiculopathy or the sciatic type of symptom, when people have disc bulges or disc herniations, as far as outcomes, meaning that one of the biggest things that they find is that if you have a loss of the normal lordotic curve from 35 to 40 degrees, and it goes into more of a hypolordotic curve, where it's more of a straightened out lumbar curve, that you have a poor outcome of getting rid of your sciatic type symptoms. Because they know structurally when you change the curve, you're going from that nice, healthy, springy curve to where you're going to have nice weight bearing on the discs and the spinal joints. The nerves are going to be nice and relaxed. There's going to be a faster, stronger nerve supply that's going down to those muscles. And then the inflammation will come back up. That's a healthy pattern. The muscles will have a better angle of pull when there's a nice springy curve to it. And it goes from there to a hypolordotic curve, where now it changes the weight bearing on that. It stretches out the spinal cord and the nerve roots to where now it's under tension. When it's under tension, it's like the spinal cord is like being pulled like a piece of licorice, and it's under this. And this tension creates compression, and that's what's going to interfere with nerve impulses. So it's going to give a slower, weaker nerve supply to those muscles, organs, and glands down in that area. And when you have a hypolordotic curve, now the muscles have to work a lot harder, put a lot more stress on the muscles. So there's going to be a lot more tension and compression. And it's going to cause a posterior migration of the disc going posterior into the nerve roots until eventually it starts creating a disc bulge and a disc herniation that's going to shear through that tension, high tension of the spinal nerve, and that creates a sciatic symptom. Studies show that you got to correct the normal lumbar lordotic curve in order to get the long-term benefits, so you can relieve that sciatic nerve symptom and that pinching off the nerve, which will reestablish optimal healthy function. What they're saying is home treatments should include some sort of extension type of work, to where you're performing extension exercises to reform the curve, and especially extension lumbar traction, so you get restoration of that normal lordotic curve. There's another study where they studied lumbosacral radiculopathy as a result of disc bulges, disc herniation. They had two groups, and they had one group perform physical therapy, that was the control group. Then they had the study group, which did physical therapy also, but they did extension lumbar traction. And they both had 3 treatments a week for 10 weeks, a total of 30 visits. And what's interesting is they found both groups helped reduce the symptom of sciatica and nerve pain. In that study, they discontinued all care from that time, all physical therapy and all extension traction, and then they waited 6 months and then brought those people back in. The control group that did just physical therapy showed that they got worse and they reverted back to their original symptoms at the beginning of the study. And the study group that did physical therapy and extension lumbar traction, they maintained the benefits of their correction during that time. So people that have lumbosacral radiculopathy or they have sciatic symptoms as a result of disc bulges or disc herniation, and they have a hypolordotic curve, that they must perform these home exercises to restore the normal lumbar lordosis. So here's an example of how that would be done. And it's important also to say that every case is different, to where even people that have lumbosacral disc bulges and disc herniation, the way you would apply this is going to be a little bit different. So it's always best to seek out someone that is trained to do this type of rehabilitation. Because in order to know if you have a hypolordotic curve of the lumbar spine, you got to get a pre-X-ray. And that will allow that practitioner to design a home program for you so you can be specific for your specific case. So an example of restoration of lumbar lordotic curve begins as number one is that you want to do extension exercises. You start off with a cobra, to where you do repetitive motion within your available pain-free range of motion, because people that have these lumbosacral disc bulges or disc herniations, it may be a little bit difficult at first in order to get that position extension. So you got to go within your available range of motion that's pain-free and gradually work up into it. So you start off performing 20 repetitions the first day, gradually work up till you get to over 100 repetitions per day before you go on to step two. Step two is 3-point traction. You want to take a towel, roll it up, put it underneath your belly button as you lay down and lie on that. The 3 points is going to be from your rear end. That's 1 point. And then the towel pushing up, and then your thoracic cage coming back down. There's 3 points there, and you're going to help restore that normal lordotic curve. So you want to start off anywhere from 30 seconds to a minute and work your way up gradually up to 20 minutes. It's real important to get up to that 20-minute mark, because you want to be able to deformation of the anterior longitudinal ligament and all those soft tissue in that area, and allow for the proper spinal molding. So it's important to put in the time under tension in order for that to happen. Perform these exercises every day for about 10 to 12 weeks. And then you'd want to go back to whoever the practitioner that is took the first x-ray and see how the progress is going, because you're going to feel symptomatically the change, but you want to make sure you're getting some long-term benefits, and you don't know until you actually take that post x-ray. And a lot of these disc type of problems have been going on for years until they eventually built up damage to where it irritated the sciatic nerve and you started feeling it. So it's going to take some time, several months, for this to actually start, in order for you to get maximal correction of this area. Now, the third thing that you'd want to do is throughout the day, for example, you want to get in a certain postures that will promote that normal lordotic curve. So instead of sitting down watching TV, you might go ahead and lie on your stomach in a cobra position, or maybe read a book or do your texting, or sometimes as you're on the computer, lay on your stomach. Because some postures, like sitting, can be very damaging, and it can actually promote hypolordotic curve and make things worse. So this time you want to try to control as much as your environment as you can to keep pushing that back into a normal lordotic curve. Performing these exercises daily, the intelligence of the body will adapt for the same reason as when you're lifting weights. The muscles will start adapting, and it'll make the changes that you put into it. So just put in the work, and you're going to see that as time goes on, you're going to make those changes that you want to get some long-term benefits from that sciatic and nerve pain. You're not only going to get symptomatic relief, but you can get that long-term benefits from that corrective care that you're doing. Also, it's important to do other types of physical therapy, and it's really important to start developing the endurance, strength, and mobilization of the core. So check out this video right here, and it gives you the best core exercises for sciatic symptoms. And if you're new to my channel, if you want more spinal-based home exercise programs, subscribe right here. We really appreciate serving you. Keep spreading the word, and we'll see you on our next video.